The iValve 10 Plus, a next-generation heart valve incorporating a state-of-the-art biocompatible material into a heart valve design mimicking the native aortic valve. Due to the rise in valvular heart disease, heart replacement surgery is currently the second most common type of heart surgery, with more than 100,000 surgeries performed each year in the United States alone. The most common type of artificial valve replacement used today are percutaneous bioprosthetic heart valves derived from bovine or porcine heart valves. The main issue of these valves is immunorejection, batch-to-batch variability, and a need for revision surgery 10 to 15 years after implantation. Our solution is a percutaneous heart valve using a novel nanocomposite material known as POS-PCU, cased within a nitinol stent, enhancing biocompatibility and hemodynamic performance.
POS-PCU is a nanocomposite biomaterial that is both durable and biostable enough to act as a revolutionary synthetic heart valve. Conventional valves such as metallic valves damages the red blood cells, and it is also not able to replicate natural physiological flow and requires patients to consume anticoagulation medicine. On the other side of the spectrum, tissue valves have a low durability and it also tends to calcify. Hence the use of synthetic valves. Current popular synthetic valves include the use of PTFE and PU, which may cause thrombosis and oxidation respectively. Our material, POS-PCU, addresses all of these problems. First of all, it has strong thrombosis resistance, strong hydrolysis, and oxidation resistance. It is also much more durable to degradation from proteins, as well as anti-calcification methods.
Stringent GMP practices will be utilised to ensure the iValve 10 Plus more than meets FDA requirements for a Class 3 medical device. A quality management system has been put in place from the outset with a focus on, among other things, proper documentation methods, traceability, risk management, and CAPA protocol. Documentation is the key to GMP. Extensive standard operating procedure documents detailing V&V testing, CAPA, and record control are all maintained and regularly checked. Under the FDA's rules, a 510K pre-market notification will need to be lodged prior to the commercial supply of our device. As POS-PCU has never been utilised for heart valves, it will not be possible to lodge a de novo application. However, we believe the proven safety of our device and the necessary documentation is more than sufficient to gain FDA approval.
PCU is a tough, biostable and biocompatible polymer with exceptional performance characteristics and is an industry-leading medical-grade polymer currently used in long-term medical devices. It has been used in implanted medical devices where it's been classified as one of the most extensively tested and approved materials by the FDA. It's currently being used in applications including neurostimulation, vascular implants, artificial heart implants, cardiac assist devices, diagnostic device components as well. Because of its exceptional load-bearing capability and biostability, it is also used extensively in orthopedic applications such as hip and knee joints and spinal motion preservation devices. It has not been used in heart valves as of yet, but through these characteristics and properties, as well as being used in conjunction with polyhedral carbonate urethane with anti-calcification nanocomposite polyhedral oligomeric silicioquartzanes nanoparticles, which proves to be fit for heart valve applications.